Hello and welcome to another episode of Local Expert Interviews. My name's Michael Grady, and today we're going to be speaking to Dr. William Hart of Hart Cosmetic and Reconstructive Surgery in St. Louis. As a triple board certified plastic surgeon, Dr. Hart holds board certifications in plastic surgery, facial plastic surgery, ear, nose, and throat, and microvascular and hand surgery. Dr. Hart offers a variety of cosmetic procedures ranging from breast augmentations, tummy tucks, rhinoplasty, and facelifts. Welcome, Dr. Hart.
Thank you, Mike.
Dr. Hart, today we'd like to talk to you about the BodyTite procedure. Could you tell our viewers what exactly is BodyTite?
BodyTite is a procedure that uses radiofrequency energy to liquefy the fat and then allows for the removal of the liquefied fat. But in addition to liquefying the fat, BodyTite will cauterize little small blood vessels that are in the area where you're removing the fat. It also cauterizes the fibrous tissue that extends between the skin and the muscle layer and causes that to contract and tighten. And when the probe is up closer to the skin, it will heat the dermis and cause the skin to contract and tighten. So this is one of the few procedures that we will see significant fat removal as well as skin tightening with one procedure.
What does the BodyTite procedure entail? What's the process?
Well, the process involves initially marking the areas where we're wanting to remove the excess fat and tighten the skin beforehand with the patient in the upright position, and then we bring them into our operating suite, and we use a local anesthetic that's injected into the tissues that contains not only the local anesthetic, the numbing agent. It contains a vasoconstrictor, something that shrinks up the blood vessels so it minimizes any bruising or bleeding, and then also has a neutralizing solution that makes it not sting and burn as it goes in. Usually the patients have had a pain pill and also something to relax them beforehand, and then after we've given them the numbing medication, we're sure that area is well anesthetized, then we'll use our handpiece that connects to the machine that produces the radiofrequency energy. If I can show you here, this is our handpiece. It has a probe that goes in through a small incision, only about 1/4 of an inch or less, that allows the tip of the probe to go into the tissues, and this is where the radiofrequency energy acts on the fat and the blood vessels and the fibrous tissue. This is on the outside of the skin, and this little disc gives you a continuous monitoring of the skin temperature so that we don't overheat the skin. We set a target temperature that we don't want to exceed, and if it hits that temperature, the machine will shut off automatically. Also, if we're administering the radiofrequency energy and for some reason an explosion goes off outside the building and you come away from the skin with this probe, then this causes the machine to shut off automatically so that we don't get any injuries to the skin with this instrument. So it's got a lot of safety factors built into it, and it also performs several functions that traditional liposuction don't perform.
Well, speaking of liposuction, how does BodyTite compare with other methods of fat removal like liposuction?
Well, liposuction involves removing the fat with a cannula. You also will treat the area with medication to numb the area in case you're performing it under a local anesthetic, or if you're under a general anesthetic, you use the epinephrine to minimize the amount of bleeding. Then you use various size cannulas to remove the fat. It's very effective at fat removal, but it doesn't do much as far as cauterizing blood vessels, tightening the fibrous tissue in the areas, and also allowing for skin tightening, which we don't see in traditional liposuction, but we do see with the BodyTite technique. Now, the other thing about this is BodyTite can be done in the office under a local anesthetic, so you don't have any anesthesia charge, you don't have a hospital or outpatient facility charge, whereas traditional liposuction is most often done in a hospital or outpatient surgery setting.
I understand. What are the benefits and what are the limitations of the BodyTite procedure?
Well, again, the benefits are that you can achieve a good level of fat removal, which is primary, and then also you can tighten the skin, you can tighten the fibrous tissue, and you can cauterize the blood vessels. So this leads to quicker healing, less downtime, and less swelling. The BodyTite procedure has a limitation in that you can only use a certain amount of the local anesthetic in doing the BodyTite procedure. You're limited by how much local anesthetic. So usually we can treat one or two areas very effectively. Sometimes if the third area is small, we can treat that as well. But if you have 3, 4, 5 areas, then very often you can't do it in one setting with the BodyTite. You might have to come back another day to complete the other areas that you want to treat it.
Speaking of having multiple areas, what's the most common area for this procedure?
Probably the most common area is the abdomen and the flanks. Another area we're seeing a lot of focus on is the upper arms, the bat wings, the excess skin and fat of the upper arms respond very well to BodyTite. It avoids, in cases that it's effective, which are most cases, it allows you to do the procedure without removing extra skin and leaving what sometimes can be a fairly noticeable scar.
I think a question that some of our viewers might be thinking is the BodyTite procedure, is this a substitute for weight loss?
No, absolutely not. The BodyTite procedure, if somebody comes in and wants to lose 10, 15, 20 pounds, this is not going to be able to do that for them. The other misconception that some people have with any of the body sculpting procedures like liposuction or BodyTite is that once they have the area treated, then that fat won't come back. And it's very unfortunate that it does come back, and you can eat all the fat back on that you've had removed if you don't watch your diet and keep your weight stable. If your weight's stable, then generally you will have a long-lasting result.
Well, I think the last question is, who would be a good candidate for this procedure?
I think it's someone that has realistic expectations, someone that is at or near what is their best or most stable weight, and has selected problem areas that they'd like to have treated. These patients usually get an excellent result with minimal downtime, and the result is long-lasting, as I mentioned, as long as the weight remains stable.
Dr. Hart, you have given our viewers a lot of great information about the BodyTite procedure. I'd like to thank you for sharing that information.
Thank you very much, Mike. I've enjoyed it.
Again, my name is Michael Grady. This has been another episode of Local Expert Interviews. We've been speaking to Dr. William Hart of Hart Cosmetic and Reconstructive Surgery about the BodyTite procedure. If any of our viewers would like to get more information from Dr. Hart about BodyTite, please refer to the phone number at the end of this interview. Again, Dr. Hart, thank you so much for this great information.
Mike, thank you for your time. I appreciate it.